Romero,
Here.
Kelso,
Here.
Bukai. Here. Wally, Driscoll.
Here.
Haynes.
Here.
Scott. Ellis.
Yes. Here.
Faulkner.
Here.
Hinckley.
Here.
Wilson.
Here.
Kosher. Layton.
Here.
Sutta.
Here.
Malay.
Here. Okay, please join us, the invocation by Mr. Marshfield and pledge to the flag, Mr. Smith.
Heavenly Father, bless us that bear responsibility. May we be led by you to do that which is right rather than that which is politically wise. Have mercy upon all 45,000 of us who live and work in Delaware County, and grant that we may give thanks to you for all the necessities of life. We ask that you be with all people as they witness national and world atrocities, causing many deaths and injuries. We ask a special prayer for peace and togetherness in our country and in our world. May those running for elected office recognize that they may come to power not to dominate or oppress those with whom they disagree, but to serve with compassionate acts of peace, justice, and reconciliation. Almighty God, we commend to your gracious care and keeping of the men and women of our armed forces at home and abroad. Defend them day by day, strengthen them in their trials and temptations, and give them courage to face the perils which face them, and grant them a sense of your presence. We ask all this in your name. Amen.
Amen.
Please join me at this time with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Okay, approval of our last board meeting minutes on October 9th. Were there any additions or corrections to those minutes? If not, they will stand as submitted. Communications.
All communications received have been referred to their respective committees for review.
Okay, I'd like to grant privilege to the floor. Supervisor Sutta.
Thank you, Madam Chair. I'd like to introduce Roland Boomer Bojo, who's the CEO of Delaware Valley Hospital, along with Cindy Ray, who's the Director of Business Development, with some really good news for Delaware County, particularly for Walton. So for that, Boomer, it's all yours.
We're gonna go up here, so Jessica. And hopefully, I won't screw up the technology. Okay, you start. You do, I'll do this. You do the introduction.
So, good afternoon. Yes, it is afternoon. I've been all over the place today, so I've kind of lost track of my day. But thank you, Madam Chair and the board, for allowing us the privilege to be here today to speak with you. So, a lot of great things going on at UHS Delaware Valley over the past 3 years. We just want to kind of share with the board what's going on and kind of where we are looking to go here in the next few years to allow us to expand our offerings and truly touch and change the way that healthcare is delivered in this county to better serve our residents. Because I truly feel I'm born and raised in Hancock Fishers. I've been here all my life, fire and EMS for I don't know how long now, 37 years. And family, same thing. Father, my kids, both heavily involved. And I feel very strongly that the people of this county deserve access to the same quality health care that those who live in bigger locations have access to. So with that, we are looking to do an investment into our facility and into our community to establish a medical neighborhood, which will allow us to better meet the needs, not only of the residents of Walton, but the residents of Delaware County.
Okay. All right. So this is just quickly, this is our medical neighborhood, which is what our goal is. A little bit of background, we are part of, DVH is part of the UHS system, and this is our mission: to improve the health of the community we serve. We're compassionate, dedicated professionals who serve our community by providing safe, effective, patient-centered care. And we live our values every day of compassion, trust, respect, teamwork, and innovation. Okay. This is where we are currently. This is DVH has added many services in the last 3 years, but we have, I think, Boomer, correct, we have literally hit a wall. Like, we are out of space. There's literally no room to increase the services that we currently offer. So we have inpatient acute and rehabilitation swing bed care, enhanced physical therapy, expanded occupational and speech therapy. There's a community pharmacy, which is available to whether you're a UHS patient or not. That's located right at the campus, hospital's campus. And DVH has enhanced their 24-hour ED. Yeah, okay, it's gonna work. Making sure. New improved services and equipment. We have Delaware Valley Hospital currently has the only full-time MRI service in the county. We've added primary care provider, GI scope, X-ray equipment. We've created 3 new inpatient rooms, new addition to our physical therapy building, and bedside telehealth. We have primary and specialty care located in Walton, Downsville, and Roscoe, and our most current addition is the walk-in. And just when I say we're literally out of room, okay, the last provider that we added, they had to convert a closet into office space for them so that they could meet with patients.
So I received an email 2 days ago from my director of primary care and specialty services, Lisa Moffett, and she said to me basically that we have converted this area so that we have moved 3 new providers in there. We've converted this area so that we have nurses in there. We took our last closet last month to be able to have a space for a medical secretary. We literally don't even have a closet left. So,
Which we all know how important closets are.
which, is not a bad problem to have. It's a good problem because we're really able and fortunate that we've been able to attract not only primary care, but specialists that really are able to help us meet our mission and serve our residents.
Right. And with the walk-in facility, I did just want to mention, Boomer, you probably know this better than I, that it's averaging how many patients per day?
So this month, we're averaging about 20 overall for the year. It's about 17, but that includes the beginning when you first started out. I think we were averaging 13. We saw 40 patients on Monday in the walk-in, plus 26 in our ER. So we saw 66 patients that day, plus 133 in our primary care in Walton. So well over 200 people on our campus just for primary care type stuff and ER services.
Okay. Our service area encompasses, this is our primary service area, encompasses approximately a 30-mile radius around the village of Walton. And as we all know, I know you guys know this, that transportation, the most significant barrier to healthcare in this county is transportation. Currently, Delaware County has no public transportation, although that may change, and we all hope that it does, right? But the size and the population density of the county means that this is going to be an ongoing hurdle. But DVH is in the ideal position to bring the vital services closer, making them more accessible to the people in the county. Okay. And just a little background where we've been. Back in April, we submitted there was a New York State Healthcare Transformation Grant that was put out, and we did submit for that. And as part of that, we have grant application, we were required to hold some kind of a public forum. And that's what we did. We had, back in February, we had 2 sessions where the morning session, we invited various stakeholders from agencies, some of you folks from the various communities throughout the county. Okay. And what we heard from them, this is just some of the comments that came out of that public forum. Transportation by far was a barrier that was identified. And the medical neighborhood will simplify transportation and increase productivity with less travel time. That's how it could be a solution. Access to follow-up care and services was also identified. One of the things that we are planning with this expansion is to include community space so that there will be facilities and space available to work collaboratively with different agencies and organizations throughout the county, and provide some educational space for maybe some trainings and other outreach programs, health and wellness. Lack of interaction between agencies was also something that was prevalent in that meeting, which of course, bringing people together under one roof just makes that even easier and more efficient. And then of course, there's also we can't ever deny our rural culture, okay, for which we're here because we all love that. But it does come with some difficulties. And one of the great things about having this medical neighborhood and having the hospitals in the county that we have is that our local providers know and understand this, what our culture is like. And we always use the example, if a farmer comes into the ED, right, and he says he's in pain, that's different. That's a whole other, right, than somebody who hasn't been born and raised on a farm. I know my grandfather, for him to not show up for work, I don't think he ever did not show up for work now that I think about it. So some of you may be wondering, what is a medical neighborhood? By and large, a medical neighborhood includes all the caregivers and services so that interact with any patient. Okay, it puts all inpatient and outpatient care under one roof. It allows DVH to provide a continuity of care and collaboration with community partners, such as behavioral health, ARC, the Delaware Opportunities, Department of Health, et cetera, provide space to enhance, and it will also provide us space to enhance and expand our current pharmacy, because currently the pharmacy and physical therapy and occupational therapy share a building on campus. And by moving physical therapy into the medical neighborhood, that will allow us to expand the pharmacy, which will include a drive-through. Okay. And bringing physical therapy and occupational therapy into the hospital itself is important because
it allows us to be more efficient, because currently in New York State, in order for a physical therapy assistant to treat a patient, which is the individuals that treat mostly physical therapists do the plan of care, and then the physical therapy assistants will do the actual treatments. In order for that to happen in an inpatient setting, a physical therapist has to be in the same building as them. So currently with our building over here and the hospital here, sometimes we'll have a physical therapist either doing what a physical therapy assistant could do, or happen to be in the building with them when maybe they could be evaluating more patients in the outpatient setting. So with bringing that all into the house, it'll allow us to a little more freedom with that, to be able to make it so that everybody can kind of work up to their top of their license.
Yep. Another really key component to bringing everything all under one roof is it increases productivity. We all know distance, as we've said, is an issue. And we're used to that when we live in a rural area. We know we get in our car and we drive a place. But for a lot of people to go to a doctor's appointment literally requires taking the entire day off from work.
Very often what you'll see with that is, especially the elderly that aren't able to drive or don't want to drive to the big city, to drive to Binghamton. So, one of their family members will have to take a day off from work, drive them there, bring them back, so you've pretty much shot a whole day. So not only are they shooting a whole day, they're also decreasing the productivity of whomever they're working for. Now, if they're fortunate and they have paid time off, then it's a little bit better. But there's a lot of people that don't have paid time off, a lot of people that work for themselves. So they're losing productivity, they're losing money. By having the services available locally, it allows individuals to maybe take a lunch or take a couple hours, go grab mom, run over, see the specialist, take them back home, maybe have lunch, and go back to work. So it's a win-win for everybody.
And of course, as I mentioned earlier, too, the extra space to bring those community activities, health and wellness, things like EMS training, CPR training, support groups perhaps could utilize that space. Nutrition and food prep, there's going to be space to do that, so more nutrition education can take place. And chronic disease management classes. We can just really extend our outreach with all kinds of, in a way that we just can't now.
And partner with a lot of the county agencies to really allow us to better work. You know, we work great together with the county agencies, but this will allow us to work even closer together because we'll be able to share some space potentially and work things together. So.
More efficient. So if somebody comes in and maybe they're diagnosed as a diabetic, right? They could literally just walk down the hall and see the nutritionist, right? As opposed to making another appointment, losing another day's work, etc. Local neighborhood, but just I call this state speak. You know, when you fill out a grant, you got to use the right the keywords, right? So these are some of the catchphrases. So what does it do? It will improve access to care. That's first and foremost, and for the people in the county. It will enhance care coordination, as we said, between the multiple agencies. Creates comprehensive services, which allows DVH to provide a broader range of services, including specialty care, behavioral health services, and social support services. Chronic disease management. It just becomes easier, more efficient, and improves the overall health outcome for that. Preventive care, very important. Again, a lot of people, if they have to take an entire day off, they're not going to that appointment that might have, where they might have had an early diagnosis or something. It's just, it creates a delay. And by having that healthcare available right here, it helps that. And then, of course, our ultimate goal always is to improve the health of our community.
And honestly, I truly believe that by having this concept and having this new building where we can bring everything together is going to help to truly improve the health indicators of this county and really just make things so that it's much easier for people to be able to receive the services and to, you know, identify things early and get treatment.
And I know you guys all know this, but Delaware County as a whole and the western end of the county in particular is that they're older than the general population. They're sicker, right? They have more chronic disease, and they're less wealthy than the state as a whole, than even the county as a whole, and the country as a whole.
And we're more stubborn.
Yes, there's that. Some of us more so than others. But this is the current facility, which, just a little background, the original hospital was built in the 1950s, constructed, and it has been renovated, rehabbed, and some expansion done since then, and it's been incredibly well maintained. But it's time to extend this to the next 75 years. And it's served us very, very well, but it's time to go on to the next thing. So this is just this is a floor plan of the existing hospital. And by and large, this footprint will remain with the expansion. A small portion, I think, of that red area on the left will be taken down. But if you see the orange kind of thing that sticks out, that's the current medical wing. That will be converted to office space because all the rooms, patient rooms, will be moved into the addition.
We'll keep the emergency department and the radiology suite where it is because they are, so we'll keep them right where they're at. That's a perfect location for them. As Cindy said, the medical area and that down there will become offices because that's another piece too. When somebody comes through the front door, you don't want them to have to walk 10 miles to receive a service. You want them to be able to, you know, access lab and radiology and such right there kind of at the front door. And the piece on the red, like Cindy said, over there will go away, majority of that, and become a part of the new building, which we'll show you soon here. Right. And the current medical office building will go away once this new building is built, and that will become parking. And
This is Boomer's favorite building on campus.
It's a very well-maintained building. It started out as a modular and has been added on for many years, so. you
This is the
talk about-
primary care building that you're looking
You
at.
talk about a Halloween maze, right there is a corn maze. Just getting through there is a maze. You have to wind in and out hallways. It's extremely inefficient for the staff and terrible for the patients that have to wander through. So we need to replace this, not only because of that, but because we have no space, not even a closet.
So we all know that money doesn't grow on trees, and this is not going to come cheap. It is expensive. However, I can say that DVH has been extremely financially and fiscally responsible, and so this is going to become reality. But of course, the issue is how do we fund it? So we've applied for the transformation grant. We would really like to get that grant, but we do understand that's an extremely competitive process. $250 million was set aside for the state for this healthcare grant, and $1.6 billion.
3.4 billion.
3.4 billion. $3.4 billion was applied.
Yeah.
So extremely competitive, but we feel optimistic. We have a great story to tell here in Delaware County. We really do. So we feel hopeful about that, but the state moves at the state speed. So we haven't heard anything back from them yet. We are currently also looking into USDA funding, which is just a large reason, some reason why we're here today, because part of that, of course, is we will require from the local governments certification of support from you, and I'll be in touch with you and ask you for that. But so the funding is going to come from grants. It's going to come from USDA funding, which will hopefully be a combination of grants and low interest rate loans and bank loans, our own cash savings.
We are very, we're not flush with money, but we're very fortunate. We've been very good stewards of our community's money, and we have kept kind of building and building so that we do have some money that we can put into this. So we will have skin in the game.
Yes, lots of skin. And then, of course, there's the fundraising component, which will not exceed $5 million of the total project's funding. But that is what we'll be looking for the community's input. We're going to try our darndest to get that to come through. So you'll see a lot of me in the next couple of years. Let's put it that way. So here you go. If you always do what you've always done, you're going to get what you've always got. So it's time to change. It really is time to take that step and move Delaware County healthcare into the future. And now's the time. It's the perfect time. We have the opportunity to be the driver of healthcare and to improve the quality of life here in Delaware County. And it's just time for that to happen. So just kind of wrap it up. Our vision for the future is to create a medical neighborhood, provide more services, add community space for health and wellness activities, and to continue to meet the community's healthcare needs for the next 75 years. Okay. That's where we're at. And we'll answer any questions you have, but I do want to cross your fingers this works. We have a little video flyby that we want to show you.
The potential building.
Of the potential building. That's fine. I lost my connection. It's not mirroring. How do I make it mirror?
You're asking the wrong guy.
Yeah.
I'll save your life, but I can't.
There we go. How do I make it move? There we go. Okay. So. Just lets you see really in context. If you've ever been to the hospital or in that parking lot, you can really visualize what that's going to look like there.
Nice looking building, but we've already, as you guys know, because you guys have built a lot of stuff lately, stuff is pricey, but we've already value engineered a lot of things to really try to keep the cost down as much as possible. Fortunately, I've been involved in a lot of building projects in hospitals previously in my other life, So it looks really nice and will be really nice, but it'll also be, it won't be a Taj Mahal.
No. No. And Janice and Anderson, the architects who are doing the design work, they're the same folks who designed the Wilson Towers and all the UHS primary care and medical facilities up in the Binghamton area. So you'll notice there is a commonality. There's a look there. And first floor is what? That's
So the first floor will be, so you'll walk in, and unfortunately, the world we live in today, we know that security is a big thing. So as you walk in there, there will be a 24-hour security guard there that will be watching cameras, but also there'll be a metal detector, the type where you don't have to stop and take everything out of your pockets, but you just kind of walk through and it detects knives and guns. You'll go through that, and then you'll receive a access badge, like visitor management, like you see most places now. So it'll be secure. The box, so to speak, that the security guard is in will have bullet-resistant glass, so that they are protected. So essentially, there shouldn't be anybody getting into the building with a weapon on them, which, again, you hate to say that, but in the world we live in today, we know we gotta be cautious about that. So once you enter, then you will then have a decision whether to go to the main building right there or whether you go slightly right and you're at the ER walk-in type area there. And then on the first floor, you'll have a new registration area there. You'll have a new laboratory.
Yep, and the registration area will be much larger than it is now, which will also afford a lot more privacy for people.
Yeah, and now with the walk-in, like registration, literally sometimes you walk in there and it's right full of people, and it's not the best for privacy. We need to correct that. So there'll be a new lab back in the back. That's that light blue color there, and there'll be a draw station that'll be right off in registration area there. So you don't have to walk that 176 feet that you currently have to walk down the hall to receive that. Physical therapy, occupational therapy, speech therapy, cardiac rehab, pulmonary rehab will be in the purple area there. And then, kind of the area that's in the brown there will be not only for us, but also for the community to use again. So, support groups want to use it. Somebody wants to come in and teach CPR. Office for the Aging wants to come in and do some type of program there. Plus, there'll be offices available for Delaware Opportunities, Office for the Aging, those type of individuals. So if they want to come to us to be available maybe once a week or whatever, so again, people don't have to travel quite so far to be able to make contact with them. And also, it allows us to truly make connections. So, the vision that I use quite frequently is, you come into our primary care, which will be on the second floor, and you're new and you're newly diagnosed, you get diagnosed as a diabetic. So we now have a diabetic educator and a endocrinology nurse practitioner who specializes in diabetes. So be able to make that connection immediately. They'll be able to start working with you. They'll also then be able to walk you downstairs. You'll be able to make contact with a nutritionist who will be able to do some work with you. We'll be hopefully partnering with the community to have some type of healthy food pantry available there. So then they can also take over, help you understand healthy food choices, which I need to understand sometimes myself, and give you, some food to last you maybe a week or so while they're working with you to be able to have access to more fruits and vegetables and those type of things. So I just really want everything to be able to work intertwined together. And, like I said, I've lived here all my life, and I worked at Delaware Valley for 10 years. I left for 18 years, went to what's now the Garnet Health System. Been back 3.5 years. And when I came back, I said, I want to go home because this is home for me. And I feel like I truly have, but I feel like I've learned a lot in the last 28 years around between there and what I saw down below. And, all the things that I saw, I don't want to say that I saw wrong, but saw opportunities with, I've brought back. And we really are working to try to correct that, because healthcare is extremely difficult to navigate. And if you don't have somebody with you who understands and can be your advocate, you get lost sometimes. And I don't want that to be the way. I want us to be the leader and to be able to lead you through healthcare to make it much easier for you to do. I'll be here all day talking, so I'll move on. But second floor will be a new primary and specialty care. We will add approximately, I think, 15 additional rooms, much more space. It'll be much better set up so that the workflow is much easier. And then we will move on to the third floor, which will be our new medical surgical unit. This will be 25 beds. 23 of them will be private rooms with your own shower and bathroom and everything right en suite, large size.
Helps with infection control.
Exactly, and just helps with, families being able to be with you. You don't have to worry about disturbing the neighbor, if whatever. That back room on the top of left-hand corner there will be a patient of size room for maybe somebody that's, a bariatric and needs a little more room to be able to bring in specialty equipment. And then we'll have two rooms that'll be special use that will allow us to care for maybe higher acuity patients that might need not quite maybe ICU level care, but additional specialty type things that we can keep and not have to transfer out to be able to take care of. And that's been one of my things too since I've been back, is truly trying to get us to be able to keep a lot more things here, because it's so difficult when people get transferred out. Yeah, there are things that we're going to have to send out because we're not going to be everything.
We're not going to be doing major surgery,
But
things like that.
90% of things maybe we can do and do well and be able to keep people here so their families don't have to travel, so that they are comfortable. A lot of the patients, when they're admitted, it's their neighbors that are taking care of them, that are the nurses, so it's good. And that's really what we want to see.
And just as a reference, in case you know where the 25 bed capacity, that's a requirement because we're designated as a critical access hospital, and that's the maximum number of beds that a critical access hospital can have. So.
And then the fourth floor is mostly going to be shell for now because
Can I just say, when we first started talking about this, Boomer said, we'll do a fourth floor because we'll use we might have need for the shell space. You can see the colored sections were already moved into the floor.
So what'll be in there is we will have a setup so that for swing bed patients that need rehabilitation, our physical and occupational therapists will be able to take them up there. And it'll be almost like a model apartment so that they'll be able to work with them in a realistic environment. So when we discharge somebody home, we're sure that they're going to be able to operate the dishwasher, be able to get in a real shower, not a hospital shower that has no bumps or anything in there. We're even going to have a small piece of car like they do at the rehab things. So that's what will go in there. And then the rest of the space, you can't build a building and be out of space the day you move in. So we need some additional space, but we do have some thoughts of future things that I'd like to see. So we'll see.
There you
I don't know the word no. It's just not in my vocabulary.
go. So, does anybody have any questions?
I have a question. So the existing facility is going to stay right where it is, except maybe the patient services support wing
Yes,
that's coming out.
that's coming off. That'll
Yeah,
be torn
and
out.
this is
Yeah.
going in the place. of that.
That'll go in the place, plus we'll go out pretty much the whole parking lot between the current building and the office. Medical office will be new building.
Yeah, understood.
And we'll be, I think it's no secret that we've bought a few houses in the past year or so. We're using them for people that, like providers that may travel a little bit distance, that may need to stay. Also, different employees that we've brought in, like our diabetic educator travels like 75, 80 miles, so she'll stay. But also, so we have some additional parking spots. That's the plan, to be able to have some. Because even right now, the biggest complaint I hear, and I feel bad, but it's kind of a good complaint, but a bad complaint, is people saying, I can't find a place to park.
I can't what?
Find a place to park. So We need to be able to use as much as we can to be able to put in some new parking areas, particularly while construction's going on. So, I know everybody's kind of wondering, and I don't know, I think it had maybe the cost in there.
I didn't tell them the
Okay.
exact
Yeah,
cost.
I mean, we're probably looking at somewhere between 50 and 60 million, probably 55, 60 million. As you all know, that's not a lot of money in today's world, unfortunately. You know, we're really just looking to do the right thing and make this county great, you know, even greater than it is. And I want my kids to grow up and their kids to grow up here. You know, I love this place. I love this county, and I will do everything I can to make sure that we have access to quality health care here.
Boomer, on behalf of Delaware County, I'd like to thank you for your vision and all the hard work I know you've been putting into this, but for your leadership in this.
Thank you.
It really will benefit more than just Delaware County. So, thank you.
Thank you. I appreciate that. I'm blessed with an exceptional team. I really am. And yeah, I keep talking, but I'll just leave with one thing. So the first thing when I came back, I said is I want to make DVH the place where people want to come work, and I want to make it the place where people want to receive care. And I really truly feel like we have hit both of them by the staffing shortages. We've been blessed. People have actually want to come and actually knock on our doors looking for jobs, because I think we follow the number one rule. We treat people well in the way that I would want to be treated as an employee.
We really do. I've been there almost a year now, and those values that we talked about in that first slide, they're there every day in every meeting, every encounter. You know, it's been just a wonderful place to work. So,
Thank you very much.
Thank you.
if you think of any other questions,
Yeah.
We didn't address today,
My
you know,
card's in there.
I didn't put your card in
No,
there.
you didn't?
I forgot. But you'll
Jerry knows how to get hold of
either
me.
one of us. Jerry knows how to get in touch with either one of us. But don't hesitate to
Joe
pick up
knows
the
how
phone,
to
give
get
us a
hold
call.
of me. You know how to get hold of me. All right, guys.
Okay.
Thank you so
Thank
very
you.
much.
Thank you.
Yes, yeah, thank you.
Okay, moving on to standing committee reports. Is there any reports? Okay, we'll move on to resolutions. First resolution, number 163.
I'll move that resolution and ask for the board to.
Is there a second?
Second.
2024 budget amendment, acceptance of additional state aid funding, Department of Mental Health.
Questions? Please call the roll.
Gladstone.
Yes.
Merrill.
Yes.
Kelso.
Yes.
Nakai.
Yes.
Wally.
Yes.
Smith.
Yes.
Marshfield.
Yes.
Arnold.
Yes.
Driscoll.
Yes.
Haynes.
Yes.
Ellis.
Yes.
Faulkner.
Yes.
Hinckley.
Yes.
Wilson.
Yes.
Layton.
Yes.
Sutta.
Yes.
Malay.
Yes. Resolution number 164.
I will move that resolution and ask for its approval.
2024 budget amendment, acceptance of cost of living adjustment, COLA, Department of Mental Health.
Questions? Please call the roll.
Gladstone.
Yes.
Merrill.
Yes.
Kelso.
Yes.
Nakai.
Yes.
Wally.
Yes.
Smith.
Yes.
Marshfield.
Yes.
Arnold.
Yes.
Driscoll.
Yes.
Haynes.
Yes.
Ellis.
Yes.
Faulkner.
Yes.
Hinckley.
Yes.
Wilson.
Yes.
Layton.
Yes.
Sutta.
Yes.
Malay.
Yes. Resolution number 165.
I will move that resolution and ask for its approval.
Second.
2024 budget amendment, transfer of funds, Department of Mental Health.
Now, some talk last time, this is one of those, state mandated 100% by the county instead of the 50% share that they had a couple of years ago. Also, we anticipate, mental health anticipates 2 to 3 more before the end of the year of these type of resolutions too.
Questions? Please call the roll.
Gladstone.
Yes.
Merrill.
Yes.
Elsa.
Yes.
Ty.
Yes.
Wally.
Yes.
Smith.
Yes.
Marshall.
Yes.
Vernal.
Yes.
Driscoll.
Yes.
Haynes.
Yes.
Ellis.
Yes.
Faulkner.
Yes.
Hinkley.
Yes.
Wilson. Layton.
Yes.
Sutta.
Yes.
Malay.
Yes. Resolution number 166.
Bring this-
that up and move for its adoption.
Is there a second?
I'll second.
Authorization for disposition of personal property no longer necessary for public use. Department of Public Works.
This is a voice vote. All in favor signify by saying aye.
Aye.
Opposed?
Here's your chance, get him.
So carried. Resolution number 167.
You make the motion on that.
I'll
bring this
Your
up.
turn.
Retaliate.
Second. Adoption of state advisory equalization rates.
It's a voice vote. All in favor signify by saying aye.
Aye.
Opposed? So carried.
My turn, huh?
It's gonna get worse as I get older.
Huh?
I hope.
Ready? Local laws.
Okay, Mr. Ellis?
I'd like to bring local law number 21 to the floor and ask for its adoption.
You're doing it one by one?
Are we, or do you want to lump them, or how do you want? We gonna lump them? All right, I'll bring local laws 21 through 33 and ask for their approval.
Second.
Okay, all in favor signify by saying aye.
Aye.
Opposed? So carried. Resolution number 168.
I'll bring resolution 168 to the floor and ask for.
Hearing local law shows number 21 through 33 of 2024.
Okay, there'll be a public hearing next meeting on November 13th at 1 o'clock. The voice vote, all in favor signify by saying aye.
Aye.
Opposed? So carried. Okay, we have two not pre-filed resolutions. I'll waive Rule 10 without objection. Resolution number 169.
I'll bring this up, move for its adoption.
Second.
2024 budget amendment, Department of Public Works.
Questions on this? Please call the roll.
Gladstone.
Yes.
Merrill.
Yes.
Kelso.
Yes.
Nakai.
Yes.
Wally.
Yes.
Smith.
Yes.
Marshfield.
Yeah.
Vernal.
Yes.
Driscoll.
Yes.
Haynes.
Yes.
Ellis.
Yes.
Faulkner.
Yes.
Hinkley.
Yes.
Wilson.
Yes.
Layton.
Yes.
Sutta.
Yes.
Malay.
Yes. And resolution number 170.
I bring this up and move for its adoption.
Second up.
Payment of audit.
Please call the roll.
Gladstone.
Yes.
Merrill.
Yes.
Kelso.
Yes.
Nakai.
Yes.
Wally.
Yes.
Yes.
Marshfield.
Yes.
Vernal.
Yes.
Driscoll.
Yes.
Haynes.
Yes.
Ellis.
Yes.
Faulkner.
Yes.
Hinkley.
Yes.
Wilson.
Yes.
Layton.
Yes.
Sutta.
Yes.
Malay.
Yes. Okay, before we go into an executive session, I would just like to make a comment that if anyone other than myself noticed the partisan politics during the county prayer, I find it highly inappropriate.
What's
And I would ask that it be refrained from in the future.
What's that?
The partisan politics in the prayer.
Well, I don't think there's partisan politics in it. That's my opinion.
Okay.
Quite contrary to yours.
Need a,
I would like to ask for executive session.
Second.
okay, all in favor?
In
signify
regards
by
to what?
saying aye.
For what?
Contract negotiations,
Okay.
sorry. Now I'll ask Kara to stay, please.
Thank you.
Okay, all in favor signify by saying aye.
Aye.
Opposed? So carried.